Hey, how's it going everybody? Remy Sovereign here from RemySovereign.com. Back with another video today, and in today's new video I wanted to address an issue that has bothered me for quite some time, and it's something that affected me personally, and I know it's affected a lot of people out there, and I wanted to specifically make a video about this issue, and it's something I've talked about before in previous videos, but never kind of directly addressed it, and it's the issue with regards to medical doctors prescribing pain medications to individuals without educating them about their lower back pain or about their lower back injury. And so here's where the problem begins, guys. It begins with the medical system, the way it's set up, and the way it's set up is to treat an individual's symptom. It's not set up to treat an individual's injury or what is causing an individual's symptom or pain. So with regards to this now, what you end up seeing happening is a lot of medical doctors, and I'm not saying this is every medical doctor or doctor out there, as there's a lot of good ones out there, but there are also a lot of incompetent ones out there, and these individuals are not properly educating people about their injury or about what's causing them pain, and all they're doing is treating an individual's symptom, being pain, by prescribing them pain medications. So here's what happened, and here's a perfect example. Take someone with a lower back injury, and they go to see their medical doctor, and they go to see their general practitioner, whatever, and they complain about having lower back pain. And as they complain about their lower back pain, their lower back issues, that general practitioner, family doctor may now prescribe some anti-inflammatory drugs or painkillers to that individual and send them off, and just telling them to rest, take it easy, maybe go to physical therapy. What ends up happening now is that this individual with lower back pain, what they will do is they'll go get their pain medications, anti-inflammatories, they'll start taking them, and this will start masking the pain or at least hiding the pain, and the individual may start to feel good and they may feel healed, for example, and they may start doing activities that they shouldn't be doing. And so here's the big issue. They start doing activities they shouldn't be doing because the pain is being taken away or masked because of that painkiller. And so the individual is now putting themselves into bad positions, potentially making their injury worse. And the next thing you know, the next day or the next few days, this individual's in much more pain, they're in severe pain, and things have just gone significantly worse. And it's due to that doctor being incompetent about actually treating the individual properly. They're not treating that individual properly. They didn't give them the proper education about their injury and what they need to avoid and what their pain triggers are. And so that's where the big issue kind of lies, guys, is if a medical doctor is doing that, then you know they aren't treating an individual with lower back pain properly. And they actually may be doing more worse. They actually may be doing a lot more harm than actually good for that individual, which is never good. And it's why so many people end up getting worse or being in chronic pain for many years or even for their lifetime for that case, is because they were never properly educated about what they needed to avoid and about their injury. And so one thing that I am always advising on is for individuals to identify their pain triggers and to remove those pain triggers as much as possible so that they can allow for their body to begin the healing process of whatever injury they may have. Now, there's obviously a lot of issues that can occur and cause lower back pain, but an example may be the case of a herniated disc. One individual may not be able to bend over or may not be able to sit. So those two pain triggers individuals would want to avoid as much as possible, because if they keep putting themselves in those positions, they're only going to potentially cause more damage and more pain, and they're going to only delay the recovery process. And that's not something an individual will want, but that's something a lot of medical doctors, or specifically doctors that are not really trained in lower back pain, will not tell you. Rather, they're just going to treat the symptom, give you some pain medications, and send you off. Not saying that's in every case. There are some really good medical doctors out there that actually do give proper assessments and actually properly educate people about their injuries. And that is good, but when we have a lot of doctors out there being incompetent, that's where the issue lies. And I don't have an issue with them prescribing pain medications as long as they're assessing an individual properly, treating them properly, and educating them about their injury. That's good, because some people may need pain medications or anti-inflammatory drugs. I specifically did in the early stages in order to sleep, but that's all I kind of specifically needed them for. Also, at times when I needed to maybe sit through an exam or sit through class, I would take pain medications as well just to kind of get through those classes. But I'd only take them as I need them. But going back to that, I was a perfect example of someone who was affected by this, because the time in the initial kind of phases when I didn't really know what was going on with my lower back, and I went into the clinic, I ended up seeing a nurse practitioner, And she'd not give me a proper assessment or proper education about my back pain. She just prescribed some anti-inflammatory drugs and to rest. Next thing you know, within a week, after taking those anti-inflammatory drugs daily, I was feeling better, but I was doing activities that I wasn't supposed to be doing, and I ended up getting significantly worse. And that's why a week later, I ended up being in the clinic again with much more pain, ended up getting worse. So that's my point that I just wanted to kind of touch on in this video, guys. If your medical doctor is just prescribing you pain medication and is just treating your symptom, then there's someone that is obviously incompetent, doesn't know how to treat lower back pain or lower back injuries, and they're not giving you a proper assessment. It's a proper assessment, and it'd be best to look elsewhere to someone who actually knows what they're doing and knows how to give a proper assessment and education about your issue and about your lower back pain. And the last tip also, guys, if you're taking pain medications and whatnot, it's important to understand that you need to identify which activities cause you pain and what movements or postures cause you pain as well. Because if you're taking those pain medications, they're going to mask the pain, and then you may go into those postures without even knowing them if you don't identify them, and you could make things worse. So it's important to understand those if you're taking pain medications in order to prevent things from getting worse, so you don't go into those postures or positions that make things worse. So that's just kind of my final tip with this video, guys. It's an issue that I have with the medical system, and the way it's set up is, it begins with us just focusing on treating the symptom and not the actual injury or the cause of an individual's symptoms. And that's where things begin, guys, and it's why back pain is the leading cause of work disability today, and it's why so much people are in lower back pain and why so much people aren't getting better. And that's one of the factors that kind of is attributed to that. And with that, guys, I just wanted to share my experience and some tips with regarding that if you're someone in lower back pain and looking to get out of it. And if you're someone that maybe has experienced this or actually has gone through this, where you had a medical doctor prescribe you just pain medications and send you off, and the next thing you know, you got worse, maybe a couple days later, weeks later, months later, or maybe you're still in pain because of that situation. I'd love to hear about your story, because it affected me, and I know it's affected a lot of people out there, and I know there's a few people that have already told me their stories, and I've heard about what they've kind of gone through. And so with that, guys, I'm gonna wrap it up with this video. Hope you guys enjoyed this, and if there's any kind of videos or topics that you want me to address or talk about, please leave some comments below about anything specific that you want me to do a video on, as we'll be happy to address that. And that's it, guys. So until next time, take care, and I wish you all the best and a successful and productive day.